We're at the 22nd CROI, and we're here with Joel Gallant, who has changed hats. He has put on the hat now of the immediate past president of the HIVMA. He's with Southwest Care Center in
Santa Fe.
Santa Fe. And I want all of us to appreciate what he's going to be giving to us, because it's a little bit of a background on some of the things, the changes that are important to the HIVMA as well as us as patients.
Sure. Well, I was chair of the HIVMA a year ago. I'm now immediate past chair, and I just wanted to fill people in on some of the priorities that we have right now. HIVMA is the HIV Medicine Association, and it's really the organization that represents the interests of primarily HIV providers, doctors and nurses and nurse practitioners, PAs, who take care of people with HIV. But of course, their interests are very much aligned with the interests of people who have HIV. And so we do a lot of advocacy in Congress. I won't say we're a lobbying group because we don't have money to throw at politicians, but we can certainly educate them about some of our needs. And it's been a very exciting year. I hadn't, as chair, I hadn't previously done a lot of work with advocacy on Capitol Hill. It's a lot of fun. One of our advocacy roles and one of our priorities had been to try to overcome this ban on blood donation by gay men. As you know, that's been in place since the beginning of the epidemic. And maybe it had some validity and rationale in the very beginning when we didn't have HIV testing and we didn't know what was going on with the blood supply, but it's long since become irrelevant. And there was a modest change, not the one we wanted. Some people initially hailed it as a big step forward, and that was that gay men couldn't donate if they've had sex in the last year. But it quickly became apparent that that made no scientific sense either. After all, we can test for HIV and know that somebody's had it within a few days to weeks of infection. So this, year of celibacy, is not based in any science whatsoever, and from a practical standpoint, doesn't put us in any different position than we were before. Yeah. So we got some work to do on that one. That was definitely a mixed bag in terms of what we accomplished, but we'll keep working on that. The HOPE Act was something that we took a very strong leadership role in, and that was simply to be able to study the idea of organ donation from an HIV positive donor to an HIV positive recipient. And the idea here is, people who desperately need organs, kidneys, livers, wait forever. They're waiting in line along with all the HIV negative people who need those organs. And if you could donate HIV positive organs to HIV positive recipients, you would expand the number of organs available, which would help both the HIV positive recipients as well as the HIV negative recipients, because you've just expanded the organ pool.
The pool, right?
We'll see. All the HOPE Act does, which was signed by President Obama. The only thing it does is it allows this to be studied. It doesn't make it happen, but it allows research to be done on it. Now, the battle is getting surgeons to buy into this, but at least studying it is now possible.
Is that like an IND, an EIND or something? Or?
Well, you would have to establish a protocol at your institution,
I see.
Get it approved by an IRB, that kind of thing.
Okay.
We've been working a lot on HIV criminalization. As people may or may not know, there are people in prisons now for example, for having had protected sex with an HIV negative partner, but without disclosing their status, where there was no transmission occurring, and they're in prison for that. Or they did disclose, but they didn't wear a condom, and no transmission occurred, but they're prosecuted as felons. So we really feel that this kind of criminalization of a medical illness is so counterproductive, because it drives people away from testing, drives them away from medical care. And the prosecutions have not been based on any scientific evidence at all. I mean, we see people in prison for spitting, for example, when we know you can't get HIV from spitting. So we've been working hard to try to, on a case-by-case basis, try to overturn these prosecutions and convictions.
It would drive them also to anonymity.
Yeah, exactly.
Yeah. Yeah, so these are some challenges, and we appreciate the fact that you do this. I don't know if people were aware of the fact that you do it, and when you were talking to the issue around educating on the Hill, I've done it. I've been to every office on the Hill, probably in the earlier days, probably at least once a year, if not twice a year, on other issues, but mostly about ADAP, getting full funding for ADAP. And it's literally every office on the Hill in 2 weeks. It's as you know, the way I do things.
Yeah, yeah. I've been fortunate. I only have to go see my own senators and congressmen, and being from Maryland and now New Mexico, that's not a difficult job. No. They're pretty friendly people.
I was going to say, yeah,
but
Sonny Boyer and somewhere, they're like cool people.
Yeah.
But yeah, I know, also you know Linda D. I
Sure,
guess,
yeah.
She's one of the activists savant.
Yeah.
And nobody messes with Linda.
No,
she couldn't be here.
Try to follow in her shoes, but I couldn't afford her shoes.
That's a good one. I have to tell her that. All right, good. But I really appreciate you being here and covering those topics with us again, and always invite you back, as you know.
Thanks, Fred.
So we'll look forward to seeing you next
All right.
trip.
Great.